Hi everyone. Hope everyone is eagerly preparing for upcoming AIIMS NORCET and JIPMER exams, and we the media team are always supporting you by providing important questions through the test series. And today we are going to discuss about test series 4. Already 3 test series we have provided to you. If you want to watch those, please go to the channel and you can watch it out. And today we are going to discuss about important psychiatric questions which is asked in previous year exams in test series 4. If you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. And we the media team are always in providing very good nursing coaching classes for competitive exam, IELTS and OET training, and also abroad nursing placements. Let's begin the session. The first question is, the term dementia precox was coined by Freud, Bleuer, Kraepelin, Snyder, and here the correct answer is option C, Kraepelin. The American mathematician who got a Nobel Prize for game theory and also has a known case of paranoid schizophrenia. Options are John Nash, Reinhard, John Harsanyi, Sylvia Nasser. And here the correct answer is option A, John Nash. He was a famous mathematician who later developed paranoid schizophrenia. A movie called A Beautiful Mind is made based upon his history. The next one is, which among the following is not a fundamental symptom of schizophrenia? Options are autism, automatism, association disturbance, ambivalence. And here the correct answer is option B, automatism. Automatism is usually a feature of epilepsy. They are apparently meaningful behavior for which patient doesn't have any memory later on. They are not seen in schizophrenia. Maximum irritability is seen in which of the following illness? Options are depression, mania, schizophrenia, and panic disorder. And here the correct answer is option C, schizophrenia. Among the psychiatric disorder, the highest irritability is seen in autism spectrum disorders. Apart from that, schizophrenia and bipolar disorder too have high irritability. That's why we selected the option C. Schizophrenia is a common presentation in which genetic disease? Options are Down syndrome, Dijot syndrome, Klinefelter syndrome, neurofibromatosis. And here the correct answer is option B, Dijot syndrome. Dijot syndrome, also called as catch-22, it is a microdeletion on chromosome 22. It is a birth defect that affects the immune system, thymus gland, parathyroid gland, and here the facial features include low-set ears, wide-set eyes, small jaw, and bowing up of upper lip. These are all the classical manifestation of Dijot syndrome. Let's move on to the next question. Which of the following is a first-rank symptom in schizophrenia? Delusion, thought insertion, hallucination, word salad. Here the correct answer is option B, thought insertion is the first-rank symptom of schizophrenia. Which of the following is not a part of catatonia? Akathisia, ambivalence, ambitendency, and akinesia. And here the correct answer is option A, akathisia. It is a feeling of muscle quarreling, restlessness, inability to sit still, sometimes a side effect of antipsychotic or antidepressant medications. The next one is, defect of conation is typically seen in simple schizophrenia, Haber-Phoenix schizophrenia, catatonic schizophrenia, paranoid schizophrenia. And the right answer is answer C, catatonic schizophrenia. Van Gogh syndrome is seen in mania, depression, schizophrenia, OCD. And here the correct answer is option C, schizophrenia. It is a repetitive self-mutilation. Self-mutilation means cutting his own body parts. Is termed the Van Gogh syndrome. It is coined after the famous painter who cut off his ear and gave it to a prostitute. A 23-year-old boy with schizophrenia is well maintained on risperidone for the past 2 months. He has no family history of the disease. For how long will you continue the treatment in this patient? 5 years, 6 months, 2 years, 12 months. And Here the correct answer is option C, 2 years. Patient had one episode and now maintaining well. He already had one episode but now maintaining well. So after first episode, continue treatment for at least 2 years. If there is more than one episode, then treatment should continue for 5 years. Antipsychotic drug with least incidence of extrapyramidal side effects and maximum incidence of weight gain. Options are pimozide, trioridazine, clozapine, chlorpromazine. And here the correct answer is option C, clozapine. The next one is, which of the following is the drug of choice in treatment resistant schizophrenia? Options are olanzapine, clozapine, amisulpride, risperidone. And here the correct answer is option B, clozapine. Incorrectly matched is haloperidol, extrapyramidal symptom, chlorpromazine, orthostatic hypotension, clozapine, hyperprolactemia, olanzapine, weight gain. Here the right answer is option C, clozapine, hyperprolactemia. Clozapine is associated with siluria, sedative effect. It unlikely cause hyperprolactemia. A patient who is taking antipsychotic for 3 weeks present with high-grade fever, raised CPK and myoglobinuria. What is the probable diagnosis? Neuroleptic malignant syndrome, tardive dyskinesia, acute dystonia, akathisia. The right answer is neuroleptic malignant syndrome. What is produced by the supersensitivity of dopamine receptors? Dyskinesia, hyperphagia, hyperpathia, hypomania. And here the right answer is option A, dyskinesia, also called as tardive dyskinesia. It is a long-term blockage of dopamine 2 receptors by antipsychotic drug which causes supersensitivity of receptor which result in tardive dyskinesia. Hyperprolactemia is seen in all except risperidone, metoclopramide, amisulpride, aripiprazole. And here the right answer is option D, aripiprazole. Being a partial D2 agonist is not usually associated with hyperprolactemia. The antipsychotic with least incidence of extrapyramidal symptom is haloperidol, thiotixane, trioridazine, perfenazine. And here the right answer is option C, trioridazine. Among typical antipsychotic, trioridazine causes minimum EPS, extrapyramidal symptom. The antipsychotic drug which causes retinal pigmentation disorder. Trioridazine, clozapine, chlorpromazine and none. And here the correct answer is option A, trioridazine. A patient of schizophrenia was started with a new drug. 3 months later, she complains of weight gain and her HbA1c was 8. What is the most likely drug? Olanzapine, amisulpride, risperidone, haloperidol. Here the right answer is option A, olanzapine. After clonazepam, olanzapine is associated with most weight gain and development of metabolic syndrome. That's why we selected the option A, olanzapine. This image is representative of the following procedure used in the treatment of depression. Options are repetitive transcranial magnetic resonance, vagus nerve stimulation, ECT, deep brain stimulation. Here the right answer is option A, repetitive transcranial magnetic resonance. This image shows the use of transcranial magnetic stimulations. Which of the following is not a part of cognitive triad of Beck? Hopelessness, worthlessness, helplessness, guilt. And here the correct answer is option D, guilt. You can see in this image they are focusing on hopelessness, worthlessness and helplessness. There is no point of guilt here. That's why I selected this option. The most common post-pubertal psychosis is depression, anxiety, mania, none. Wrongly I have mentioned depression again. So here the correct answer is option A, depression. The period of normalcy is seen between two psychoses. The diagnosis is schizophrenia, manic depressive psychosis, alcoholism, depression. And here the correct answer is option B, manic depressive psychosis. It was the older name for bipolar disorder. In bipolar disorder, in between the episode, patients is usually normal. The last one is chromosome associated with bipolar disorder. Chromosome 16, 18, 23, 13. And here the right answer is option B, 18. So here we ending the session. If you want to contact us, please contact in the given phone number, mail ID. If you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. Thank you very much for watching this video.